Hi, it's Dr Michael Ghobrial here from Shaw Dental. Last week, Michelle took a phone call from a lovely patient, Greg, who lives in Ascot. He hasn't been to the dentist for a while and he had a throbbing toothache that had kept him up all night. He was a bit nervous about coming in because he hadn't been to the dentist for so long and he wasn't sure what to expect. I overheard the conversation and it got me thinking, I wonder how many patients are wondering what happens if I have a toothache? What's the dentist going to do? And it was nice to overhear Michelle explaining everything to him. And he came in, we saw him later that day and we relieved his discomfort, but I thought I'd record this video to let you know what to expect if you have a toothache and you're going to go to the dentist. The first bit of advice is if you do have a toothache and you know you have an appointment to the dentist, please try to refrain from taking any pain relief on that day, because the dentist is going to be trying to figure out exactly what the cause of the pain is and what the source of the pain is. And sometimes pain relief can actually mask all of that. Now, if the pain is too unbearable, it's understandable, please do take it. But if you can withhold those few hours before the appointment, it'll be really helpful for the dentist and his ability to diagnose. The first thing a dentist is going to do is try to assess whether the pain is actually from a tooth or whether it's from something else other than your teeth. So things like your sinuses, when they flare up and you have severe sinusitis, it can really feel like a bad toothache. Equally, earaches can radiate down and feel like a toothache. So the first thing is the dentist will ask a series of questions that's going to help them determine whether it's likely to be a tooth that's causing the problem or whether there's something else going on. The second thing they're going to do is they're going to look in your mouth and see if we can identify the problem. We may do a few tests to try and identify the tooth, and once we've identified the tooth, the question is it salvageable? And if it is salvageable, does the nerve have reversible or irreversible damage? And we use things like radiographs, we do special nerve testing, and sometimes we put pressure on the teeth or tap the teeth to try to get the answer to these questions. And depending on the answer, that'll determine how we will relieve your pain. Here at Shaw Dental, one of our aims is when a patient comes in with a toothache, we want them to walk away relieved. We want to figure out the source of the pain so that we can actually relieve it. And depending on all the testing, we normally sit our patients up, we have a good conversation about what their options are and what the best way and the most simple way to get them out of pain is for that day. We'll then normally follow up and catch up and debrief, check in on the tooth and make a plan moving forward once they're comfortable. So if you've got a toothache, I want to encourage you to please do go to the dentist, and if you're around Brisbane, then we'd be more than happy to look after you. Just simply complete our form on our website at shawdental.com.au or call us on 32569111 or direct message us via social media, and one of our team will be in touch to organise a consultation. I'll see you at the next video. Thanks for watching. I hope you enjoyed the video. We are regularly making new videos with tips and tricks for your dental health. So please subscribe so you can see our next video. Until then, I'll see you next time.